Today I will talk about Cryolipolysis, our potency clinic patient satisfaction study. And so the next slide, and here you may see it's a picture of the clinic. It's a private clinic for aesthetic, plastic, and reconstructive surgery. It's one of the largest clinics in Germany, and we are bordering the Lake of Constance, the Switzerland, and the Austrian Alps. You see my daily work view. You see our entrance hall. So it's a place where you may do your holidays, and I love to work there. And we're by 90% orientated for surgical therapies. So of course we do non-surgical treatments like injectables, fillers, Botox, lasers, and of course cryolipolysis. But mainly we're orientated surgically, and this is the step where we come to cryolipolysis. We do that now since 2016, and I love to do liposuctions, and we came in contact with
tightening of skin. So we get a holistic approach where you don't have these sagginess, and especially when we're talking about the visceral fat, as Jens has mentioned, there is a lot of bulging as well, and there is some excess of skin, and you will have to do normally something surgical with that. But with this program, we can go further by combining all these technologies. So the first step is slimming and helping them change their mindset. And then we do the sculpting, then we do the toning and lifting at the same time. So when we do the first step, we use an aid. So when we're talking about the swallowable balloon, that's what we are using. It's just an aid. It's nothing more, nothing less. I tell them at the beginning, you will have to do the work. I'm going to help you by helping you.
Happy that I added this here, where the detail can make also the difference with this kind of procedure, no, as a touch-up and to complete sometimes surgical procedures that have been performed before. I am based in Milano. I work between Milano and Dubai, as Tim said before, and as we know, the aesthetic treatments are becoming great. You already mentioned that, and in this case, they are part of overall wellness and self-care, which is very important for us. We know the percentage of people that would ask for excess body and chin fat in specific areas, and the most important thing is that they would prefer the non-surgical overall procedure, which we were saying before. So we talk about my experience as a plastic surgeon with cryolipolysis.
So in 2011, I cannot see the slide. Actually, the slide actually only on the first one. Is that correct?
Oh, yeah, okay. I'm changing over.
Yeah.
Can you see that now?
Oh, yeah, sure.
Yeah.
Could you please only press the presentation button that we can see the slide will be changed after you press the button. Yes.
Can you see that now?
No.
No, still.
Yeah, we can see the slide, but I think you can actually click on those that you can just kind of load it out, so we don't see on the side of the screen. Yeah.
Okay. Can you see that now?
Sure.
Yeah.
Yes.
Can you see demand?
Yeah.
Yes, we can.
Yes.
But you're not in presenting mode.
You haven't pressed
reduction. All right. Can anyone here tell me what that actually looks like? You have a patient there. You say the average reduction is 27%. I ask them, what does it look like? They look at me. I look at them. I say, I also don't know. I actually don't know what it looks like. So I actually create a few scenarios that are possible at the end of the 8 weeks. I say, look, all right. Depending on how you respond, there's going to be 3 scenarios. The first scenario is, and I say, this is where you come back and say, Dr. Lee, that was amazing. I'm so happy with the results. Thank you so much. See you next time. Now, I classify these people as hyper-responders. They get a very significant outcome whereby, they're happy enough with it. Great. Now, the second group are what I call the average responders. These are the people who see a difference. All right. These are the people who say, look, I see a difference, but I want more results. Can I do it again? And already you have put into their mind that the average person who gets the 27% needs multiple treatments. All right, but it also means that it works. Now, the third group, which is what I call the poor responders, I don't believe in non-responders, all right? I believe they are poor responders, and they do that for different reasons. But the poor responders are the one who come back, say, Dr. Lee, I can't see much at all.